As a researcher, Dr. Garcia, you're on the front lines of AML treatment. Are there new and emerging therapies that patients should be aware of?
Yeah, I think we're at this really exciting point now where we have for a long time just been giving people standard 2-agent intensive chemotherapy. We have been studying in phase 2 and phase 3 settings, and even in phase 1, which means testing safety for the first time. We've been moving a lot of treatments to more mature settings where we're testing the addition of a third drug. So for people that are getting intensive chemo, we're looking at, can we add a pill to augment responses, deepen them, to reduce risk of disease returning? For less intensive chemotherapies, one of the most common regimens we now use is something called azacitidine, which is a hypomethylating agent that is given by IV or subcutaneous administration, plus a pill called venetoclax. We helped to get that FDA approved a couple of years ago. That combination of therapy, we call that a doublet, meaning it's 2 drugs. Because it's so well tolerated and active, we're now asking the greedy question of, well, can we make it more active for patients since we're seeing how well tolerated it is? So there have been a lot of therapies that are currently under investigation that are adding a third drug to these less intensive doublets. And so there's a lot of therapies under investigation to test. Can we add an immunotherapy target? Is there another pill that we can add? Is there another targeted mutation to add to the doublet? So we're looking at AML therapies from different angles. We're looking at adding something to the existing new standard of care. Those are these new so-called triplets. We're looking at still the role of cellular therapy or CAR-Ts targeting leukemia cells from a immunotherapy standpoint. That remains underdeveloped overall, and we have not succeeded as well, like our lymphoid colleagues in the lymphoma and acute lymphoblastic leukemia realm, where there's drugs that are active and FDA approved. So we're still trying to identify the right target. But those are some of the areas that are currently under study.